Well, I liked anything that dealt with the brain and its complex function. And in my first year, anatomy and physiology as well as biochemistry, we learn how the brain functions and how the memory is recorded and how the chemical events happen and how 20 years later you just have to have a smell that will remind you the event that will drag so many things right in front of your eyes while it happened so many decades ago. And that was fascinating. It's still. And that's how I got interested in the brain and its physiology. But choosing neurology was one option, but it did not allow me to use my hand skills, and I like to draw. I was very good in drawing when I was a student, so I thought I could try to combine uh, science with hand skills, and neurosurgery itself had all these elements together, including research, which is a crucial part in the specialty. First, it's very complex. It's to summarize it, a neurosurgeon could be on top of the world 10 minutes and down at the bottom the rest. But those 10 minutes are so valuable. For example, you operate on somebody and they were in excruciating pain, and then in the recovery room you see them and that pain is gone, and there is a big smile on that patient's face saying, "Doc, thank you." Then you feel like you accomplished a lot. Uh, Doing, for example, clipping an aneurysm, performing aneurysm surgery, you have the most stressful aspect of surgery at all. You know, the most stressful aspect, because if an aneurysm ruptures before you clip it, it's very hard to perform a good clipping of that aneurysm. But yet, once you clip it, everything is done, the patient is taken care of, and the recovery should be, if there is no complications related to the hemorrhage, 100%. So rewarding is when you perform a surgical act and it is successful and you see the results, knowing how difficult it was, and knowing how the patient's condition could have been without that intervention you did, makes you feel great. And the more challenging, the more the reward is. Well, I think the applicant to be eligible to get into neurosurgery, first, honesty as a physician is very crucial, and endurance during the training, how strong that candidate is. Intelligence is one of the elements that helps be a good surgeon. And also skills, you know, you have to have a little bit of hand skills that allow you to manipulate the microscope, the micro instruments. But all in all, you want to have a candidate who's very, very committed to the specialty. And it is not a partial commitment, it's a total commitment. Because even though with the reduction of hours, you will have less time spent in the hospital, you still are committed to get updated, to get with the current events, the current publication and all that, and that requires a lot of time. But with all this said, it is very feasible, and people who are decided to do it and willing to do it can do it. Devotion of time to the life, to the lifetime to family and work is a serious question, and it used to be much harder before for the residents. For example, when they had the 120 hours, you know, before there was no limit. Now we are limited at 80, and maybe it's going to go down to less than that. Once you are an attending, it all depends on you. If you are in private practice and want to work extremely hard and make a lot of money, then you're cutting down on the time spent with family. If you want to live a decent life and be a good neurosurgeon, you can still have good time with family. But going into academia makes it a little bit easier on you because you have control on your schedule, although with a trauma level 1 like we have here is a little more difficult, but still it's a better life in academia because you have the research relaxed, and you have the surgical intervention, and you have the teaching. And all these times allow you to take some time and think, and you have more time with family in academia than in private practice. I think the biggest challenges in the field remain cancer and brain cancer, and in particular the malignant brain tumors. This is, I think, going to remain number one. I would say maybe infectious processes, infection that we have difficulty to control right now, HIV and its brain involvement. Vascular challenges with the conditions that we're dealing with, obesity and all its complications leading to stroke. This is another big part of the challenge. But what's coming, and it's going to be, and it's going to, we will all have to deal with, is that the aging of the population is going to be a major issue, because we're going to be treating patients who are 100, 110, 120 years old. And that has a geriatric population going up the roof with all what it entails of changes in the brain function, changes in every organ of the body, and in particular there will be changes in the brain, Alzheimer's, senile brain, dementia, and also the spine, and all the vascular system that can be involved. Of course, vascular system involved in the brain function. So so many issues coming up with modern life that we're going to have, because we're going to be aging more. But what is the current biggest challenge is malignant brain tumors that we have still difficulty treating. I think, again, I would go back to what I said. They should know that it is not a commitment for 1, 2, 3, or 5 years. It's a commitment for life, and that it's not going to be wonderful on every case. There are cases where, despite everything you do, you will be disappointed and depressed. For example, glioblastoma multiforme, the malignant brain tumors. There are sometimes, despite an excellent surgical intervention for aneurysms, for example, we do not know how to treat the vasospasm, and the vasospasm could kill the patients after a good surgical intervention. So many things that could happen despite the excellent job of the neurosurgeon. So don't expect wonderful results all the time. Just accept the fact that you have to do your best, and then you will have the gratification of performing that, and there will be many times where you'll be extremely happy with the result, and some other times where it's going to be tough on you, tough on the family, tough on the patients.